How about that?
There we go.
All right. So
Perfect.
the presentation starts with our title, Vaccination Policy in the Workplace. As you know, things are changing. Employers are reopening, welcoming workers back, more industries, more businesses. The United States has administered the most coronavirus vaccine doses in the world. We have more than 40% of adults and 75% of seniors at least partially inoculated. You know, we have a significant portion of the population, 16 and under, who have not been vaccinated yet, but that is about to change soon. And we have different success rates for vaccination depending on what state we're in. Each state is doing a little, has a different penetration. This map that was just created last day or so shows those states that, you know, as far as percentage of all residents given at least one shot of the vaccination. And you can see it varies state to state. In the top right corner, you see New England has a number of states, 38% or higher. New Mexico, South Dakota up there as well. And then there's variance depending on different states where you are. As far as Palm Beach County is concerned, 22% of the population is fully vaccinated as far as all residents are concerned. Recent polls have shown that there may be as much as 25% of the entire population which may refuse to take the vaccine. So that's a very controversial issue, and it's going to be a limiting factor. Recent polls show that there's a pretty high percentage of Republicans who identify as such who do not plan to get the COVID vaccine. There's a political component to it, not a surprise after the mask became a political issue. And what we have facing us in the workforce is, in reopening and having the workforce come back to work more than they may already have, is what kind of approach do we take to having a workforce that can have a safe environment and be able to interact with other workforces and other businesses and other industries. So we have a situation where we've got variants of the virus. We're still learning as to whether each or all of the vaccines are successful in warding off serious illness due to the variants that apply. And we're headed towards a situation where we're going to have some businesses and industries that have the workforce come back, some businesses where part of the workforce has been vaccinated or already been exposed to the virus. To what extent do they have antigens and pathogens in place that will help protect them? We don't know yet fully as to whether and to what extent those who've been vaccinated could transmit. So just being vaccinated by itself may not be the end-all answer. The scientists speculate that in order to reach what they refer to as herd immunity, they think we need 70 to 80% in that range of the population in a position where they've been vaccinated or they've already been exposed and survived. And we also know, of course, there are certain subpopulations that are more susceptible to getting sick and having serious problems. So the question is, are we going to get to a point where other countries have gotten to where they have something in the way of proof that workers have been vaccinated to the point, or people in society have been vaccinated to the point where they're allowed to return to work in larger numbers? And we're going to need to know the degree to which the virus is still a threat, and we're going to need to know what percentage of the population that has developed immunity so we can plan intelligently, et cetera. So we're at if you want to look at what's trending right now in the news, just 2 days ago, Governor DeSantis in Florida issued an executive order prohibiting the use of vaccine passports, so-called vaccine passports. Apparently the cruise lines have been closed down for a year now, and the cruise lines wanted, as part of their safety plan that they were asked to create by the CDC, part of their plan was to make sure that all of their staff and workers were vaccinated so that the cruise industry could start up again. And they wanted all of the passengers to have proof that they had been vaccinated. Governor DeSantis, for his reasons, issued an executive order prohibiting, then banning that part of the cruise line's plans. And then 2 days later, literally just yesterday, was announced that Florida had filed a lawsuit against the CDC to try to have it remove its prohibition against its closure of the cruise industry. So as you can see, I wouldn't call it a schizophrenic kind of reaction, but on one hand, the industry itself is trying to come up with a plan to reopen. The state government, imposes a ban against using, proof of vaccination, and then turns around and files a lawsuit against the CDC, demanding that it allow the cruise industry to reopen because the base argument is that the CDC shouldn't have authority to prohibit an entire industry from operating. So what does our guru Maven have to say? Axios reported a couple of days ago, Dr. Fauci indicated that the federal government would not be requiring COVID vaccine passports. That's not where the federal government is headed. The reference to vaccine passports basically some kind of proof that a particular person has been vaccinated, something that would help in international travel. And some other countries are moving towards use of them. China's had them for a long time. I know Israel has some kind of written proof and basic vaccination passports that allow citizens to attend certain kinds of events, et cetera. And then you've got some states, Pennsylvania, Texas, Florida, which have thus far issued bans against the use of the vaccine passports. And Dr. Fauci says, I doubt the federal government will be the main mover of a vaccine passport concept. And you can imagine with all the political pressures in our country and this particular sensitive time, it doesn't seem likely that the federal government will try to impose that kind of requirement. And Dr. Fauci says he's not saying whether they should or shouldn't, but he just doesn't see the federal government getting involved. He can see independent entities saying, we will not be able to do business with you unless you can demonstrate to us that you've been vaccinated. But it's not going to be mandated by the federal government. And yet the EU did unveil its proposal for vaccine passports back in March so that citizens can travel between and among different countries so long as they can prove that they've been vaccinated. As far as the World Health Organization is concerned, the World Health Organization recently, just on Tuesday, stated that it does not back at this time the use of vaccination passports in connection with travel or otherwise, and we'll see if that changes. So the question arises, maybe individual businesses or industries will set the pace. So the question becomes, as an individual employer, what should your policy be in the workplace? Should it be mandatory? Should it be something that's merely encouraged or purely voluntary? It seems appropriate. The time is right now with the vaccines being made available and rolled out to almost just about everybody. It would be hard to have a policy up to this point where many people couldn't get the vaccine, but now that you can sign up for it and become vaccinated, employers are now at that threshold position of having a policy and implementing it. And you could be sure that with the myriad of kinds of businesses and business environments, one size does not fit all. It's just not going to be possible to come up with some kind of universal kind of an approach. And it's going to have to be customized for each individual employer, as you can imagine. And there are various pros and cons that might be applicable to your particular business or industry. So what are the pros, the reasons for developing some kind of a policy? Some are pretty obvious, but still worth mentioning. Employers are uniquely positioned to have some kind of requirement if that's what it decides to do. Employees who receive vaccinations will be able to come to work with much greater safety in place. As employee vaccinations increase, it should promote a more stable and reliable workforce as opposed to being fragmented. And it may help to lead to a return to normal, which we're all craving this past year. And it may head in the direction of making progress toward herd protection, which we're going to need as soon as possible. Certainly, employees will feel more comfortable returning to work if everyone is vaccinated. Those of you who have become vaccinated, you already know the feeling of relief, or you have loved ones who've been vaccinated, you know the feeling of relief. And customers and clients and other business people and professionals that we might be dealing with, contractors, service people, et cetera, all may feel more comfortable knowing that employees in a particular business have been vaccinated. What are the cons? What are the arguments against? Well, I was recently reminded that the vaccines in place were approved only under the EUA, the emergency use authorization. If you remember, these vaccines have not received permanent acceptance. So to a certain extent, we haven't gotten to that point. The vaccines are approved on this temporary emergency use authorization. So if we're now, putting a policy in place and making it mandatory or encouraging employees to come back to work, the question is, how comfortable and how certain are we that we have a safe working environment to be bringing back employees? It may be that requiring or encouraging employees to come back to work may allow them to blame or even sue the employer if the employees have any adverse reactions. And there are morale and employee relation issues, of course. There are many reasons why, we've all heard of many of them, reasons why employees may be opposed to a vaccine. If you remember, for years leading up to the COVID-19, we've heard about anti-vaxxers in general. And if anything, that may have intensified with the COVID-19 vaccines in place. There are political reasons, which we're all too familiar with. Employees may have some disability or medical reasons for not taking the vaccine. Women who are pregnant or lactating may have certain concerns about taking the vaccine. Others have religious reasons for not taking the vaccine. And there is also an underlying fear or uncertainty of the long-term or unknown effects of taking the vaccine. We're all learning every day about long-term effects of being exposed to COVID-19. Those kinds of feelings and fears exist among a significant portion of the population with regard to the vaccine. What will happen to us in the future? I've heard a lot of people say, well, I'm just going to wait and see what happens. While you're waiting to see, you may be exposed and you may have serious problems. So it's damned if you do, damned if you don't for many people at this point. One of the reasons for not having a policy is that there's a potential risk of a disparate impact on the workforce. I mean, are only Democrats coming back to work, but not Republicans, or only young people, but not older people? More men than women, et cetera, et cetera. So there may be a disparate impact on the workforce itself. So an employer has to consider, do we implement a mandatory vaccination policy? Do we just encourage employees with or without incentives or employer assistance? How do you encourage? Well, maybe you make sure that you let your employees know that if they take time off to get the vaccine, or they have some minor reaction to it, they need time off, that it'll all be paid for by the employer. Maybe there's education that the employer can provide to the employees to encourage the employees as opposed to making it mandatory. Or it could be strictly voluntary. But each employer, especially multi-state employers, must find out what are the applicable state or local laws that may apply with regard to vaccination policies. And there are also other issues related to retaliation, where employees are encouraged to come back maybe it's made voluntary, but then all of a sudden there's discipline imposed where they're fired or laid off without pay, et cetera, et cetera. They had been working at home. Everything seemed to be working fine. All of a sudden, the employer wakes up one day and says, well, it's time for everyone to be back in the workplace. And if you don't come back, and if you don't have a good enough reason for not coming back, we'll terminate you. And then all of a sudden, there might be complaints of employees who say, why is it necessary? Is it really necessary for me to come back? Maybe I have a disability that prevents me, and I can present you with a doctor's note and be entitled to protection. Employees may complain, and then all of a sudden you've got a situation where you've got some National Labor Relations Act issues with regard to retaliation, where workers try to come together and communicate about problems or issues in the workplace. So there are many different considerations. There are ADA issues, Americans with Disability Act, if employees have disabilities, et cetera. Pregnancy Discrimination Act, I mentioned, et cetera. You should know that the EEOC has provided guidance, and you should review the guidance from the EEOC. Even back in December, the EEOC provided a COVID-19 vaccination, frequently asked questions. On December 16th, the EEOC, you should know, has not come out and said that employers may mandate vaccinations, but they haven't come out and said that they cannot. So the inference that almost everyone has drawn is that employers, we've known for a while, are allowed to test employees to see if they have a fever, or they can ask questions as to whether they've been exposed, et cetera, or maybe suffering from COVID-19. But employers can ask whether employees have been vaccinated or not. When an employee says no, there are restrictions against what the employer can ask about afterwards. Employers should not ask why, because sometimes when you do that, you're now inquiring into areas that could open you up to a discrimination claim. And if by asking why, what you're doing is you're forcing the employee to disclose personal, private, confidential health information, that may be a violation, and you may need to avoid that. Obviously, if the employee asks for a reasonable accommodation and the employer engages in the interactive process, then it becomes necessary and appropriate to learn about such information. Also, the EEOC guidance does not direct itself to local or state policies and procedures. You still have to take a look at those. So if an employer asks an employee to provide proof of a vaccine, having had a vaccine, just asking for that proof of having had the vaccine is not considered a disability-related medical inquiry that might be prohibited or forbidden unless there was a specific legitimate reason to ask. And when asking whether an employee has been vaccinated or not, employers should be very sure to warn the employee, please do not provide any medical information as part of your answer, as part of that proof. And don't provide any genetic information. The federal statute with the acronym GINA, prohibits employers from discriminating against employees based on genetic issues. Again, that could open up an employer to potential liability. And definitely employers should not ask employees why they did not take the vaccine unless the employee asks for a reasonable accommodation and says, well, let me tell you the reason why I haven't taken it. I want a reasonable accommodation. I want to work from home as my accommodation, and I have reasons for not taking the vaccine. I'm pregnant, religious reasons, et cetera. I will tell you that the answer that I'm worried that by taking the vaccine, I may get COVID and be affected by the virus that way, by itself is not considered a legitimate reason. So what factors should an employer consider in determining whether to allow unvaccinated employees to remain in the workplace, to come back? Because you could try to encourage it, you could have it voluntary, but if the employee refuses, maybe you'll consider employees coming back under certain conditions. So you want to consider What is the prevalence in the workplace of employees who have received the vaccination? If 90% or 95% have received the vaccination, just having a small percentage come back may not pose as much of a threat. How much contact, close contact, occurs in your workplace? How much contact do you have with customers, patients, and others, et cetera? If you don't have much contact, then maybe the threat is that much less. And how much contact you have with vulnerable populations, nursing home residents, et cetera. And what is the effectiveness in your workplace of other controls, whether it's the shields, the distance, the scheduled sequencing of shifts, the limitations on how many people work, how closely together, et cetera. And of course, you want to consider what's the prevalence of the presence of the COVID-19 in your particular geographic area. If you're in an area where there's a low incidence right now, it's one thing. If you're in a hot zone, it's something else. So it's important that even if you have vaccinated employees back, you still want those employees to do all the things that are important. You should still do temperature screening. You should still do face covering, still do social distancing, maybe not have people in the lunchroom gathering, et cetera, et cetera. The CDC says we should still follow those policies, even if someone's vaccinated. So what are the best practices for employers? Have a written policy. Let everyone know what the policy is and decide, is it going to be mandated or voluntary? How does each employer handle requests for an exemption from the immunization? What kind of reasonable accommodations are requested, and are you willing to provide? Nowadays, with everyone having worked from home for a year, sometimes it's awfully hard to turn to someone asking for an accommodation and say, well, no, we've decided that now everyone really needs to be in one place, when basically things have worked relatively well with people working from home. So what kind of incentives do you want to provide? Do you want to provide monetary incentives? You want to provide paid leave to take care of vaccinations, et cetera? So there are a lot of things that can be done. What are your company's leave policies? Maybe you'll adapt them with regard to the vaccination issues. Who's your point person? Who's your vaccine point person in your business to handle vaccine-related questions in a uniform, informed way? And how do you communicate your policies to your employees? You need to know that. And once you learn who's gotten the vaccine, who hasn't, how do you keep track of that information, and how do you keep it confidential and not mix it in with the rest of personnel information? That kind of information should be kept separate and not shared. And you want to let your employees know whether you're going to cover the cost of them getting vaccinated and what they can expect once they've had the vaccination. If they don't feel well, they get paid leave, et cetera. So the bottom line is there are some best practices. You have to consider the recognized legitimate reasons for employees refusing or being reluctant to become vaccinated. If you want to make it mandatory, realize that you're probably increasing your chance of messing it up and getting sued. If you want to encourage it, is that something you can live with? To what extent is it essential that everybody be vaccinated in the workplace? If you should communicate with the employee in question in a private, confidential way. Engage in what the Americans with Disabilities Act requires, the interactive process. Keep good documentation as to how things were handled. Manage requests for accommodation. Basically, if a reasonable accommodation creates an undue burden for the business, the ADA has an exception where the employer doesn't have to provide that accommodation. The accommodation doesn't really reduce or eliminate the potential problem with the employee being there or not, then it's not an accommodation that has to be given. Just because the employee asks for it doesn't mean it's automatically necessary or required. So even if an accommodation is oral, you still have to deal with those accommodations. So those are various considerations. And let me move on to some additional slides here that we have. We've spoken, basically, Excuse me. I'm having a little trouble. Here we go. So what you want to do is you want to be concerned about whistleblowers and avoid retaliation in all of its forms, because you don't want to be in a situation where employees are complaining that you're violating OSHA, you're violating the ADA or FMLA or the recently enacted statutes that provide protection for employees, or you're creating an unsafe work environment that may implement workers' compensation, and maybe there's retaliation under that. So just be very careful about how you deal with employee complaints and issues, because as soon as you know that an employee's made an oral or written complaint or something that looks or sounds like it may be, go through the mental checklist to make sure you're not turning that employee into a whistleblower and exposing the company to liability. Okay. The NLRA I mentioned earlier, if workers get together and they complain, whether it's on social media or otherwise, don't punish them or discipline them. They have a right to try to organize, and you might be liable for retaliation under the NLRA. Avoid discrimination based on potential bias. If you're going to treat your employees a certain way, don't treat certain kinds of employees differently from others. You still have to comply with your obligations under the FMLA, Family Medical Leave Act, and same with the Americans with Disabilities Act. And the best advice, I don't know if it's the best advice, but certainly uniform advice, with everything being more and more challenging nowadays, I think it's important to get employment practices liability insurance in place, review your policy, make sure with your insurance broker that the policy you have covers the kinds of problems that may arise because of issues related to vaccination policy in the workplace. So I think I'm going to end there, and I'm going to stop sharing and turn it over to Romeo. Thank you for listening, and I'll be happy to answer questions afterwards. And Romeo, I think you're on. Hold on, Romeo. I have to unmute. I'm going to ask you to unmute. I just asked, and you're going to accept.
There we go.
There you go. Go ahead, Romeo. Romeo, please introduce yourself. Although many people joined late, I just finished my presentation on vaccination policy in the workplace. If you didn't know, I'm Steve Schwartzberg. I've got 40 years plus as an employment law attorney, especially in litigation in a wide variety of matters. Romeo is going to introduce himself, and we'll be happy to answer questions at the end. Go ahead, Romeo.
Hi, good afternoon. I'm Romeo Chico, a CPA and president of Paymaster Payroll Service for the past 26 years. And I'm going to present for the next half hour on these two acts, which came in and modified a lot of previous acts, and they do work hand in hand. So I'm going to cover both of them. And let me change my view here. And the first presentation that Steve and I did was about a year ago, and we've done a few of these over the past the past year on everything COVID. And I just looked back at our original first presentation on COVID, and I just took a screenshot so you can compare of the effect of COVID on us over the past 11 months. And evidently, I need a haircut. And I think Steve has gotten a bit grayer since this picture a year ago. So that is another side effect of COVID. All right. So jumping into my presentation, I normally do this presentation in an hour. I did it in 5 minutes for an executive group. So this one is going to be right in between. So I'm going to cover a lot of information. Some of this just a top level overview. If you throw your questions out there, I do have my contact information at the end. So you're welcome to reach out to myself as well as Steve, and we'll try to answer questions. The first piece is the PPP. The loan process, the forgiveness process had opened up late last summer. And if anyone asked me, I was telling people, do not file for forgiveness. There's no first place trophy. You don't get a medal or ribbon for being the first one to get forgiveness. Just don't do it. Now is actually the time you should look into this. The ARP Act made a lot of changes to make this process easier. The SBA just came out with the new forgiveness applications on January 19th. And it's literally taken the banks about this long to implement these new forgiveness applications. So banks are just now having these new apps, and your forgiveness process should be very easy, especially if your loan is less than 150,000. It is literally just in the car industry, they call it the sign and drive. You just sign a document saying I spent the money appropriately, I did not commit fraud, and just like that, your loan is forgiven. If it's above 150, there is a little bit more you have to do, but still relatively easy. On the other side of PPP, of acquiring money, the second draw had opened up earlier this year. It was to expire at the end of March. There is still money left, so they extended it until May 31st. So if you were considering getting a second PPP, if you meet the qualification where you had a 25% decrease in revenue in any quarter, last year compared to 2019, you should, get a second round. The amount is the same as the first round, unless you are in the food and beverage or hospitality industry, and in that case, it's determined that your industry is harder hit and you're eligible for 3.5 times. There were a few other changes that President Biden put into place in March that allowed more nonprofits to be eligible for a PPP. So if you were a nonprofit and you were not eligible before, that changed just a few weeks ago. So you may now be eligible. The same goes for sole proprietors and independent contractors. You may have seen in the news recently that a lot of them had only received like $1 or $10. President Biden changed the way it's calculated for those individuals that are the Schedule C filers, the sole proprietors. So again, if that is your case, you should go back to the bank as that process has changed. So as Steve was talking about getting vaccinated and so forth, there was a question that popped up about that being covered. And that is, so the Families First Coronavirus Response Act, this was the very first act that was passed. And a big part of this was allowing your employees to take sick or family leave that was paid by the government. You received money back through a tax credit. The original act expired in December. President Trump extended it in December through the CA Act, which ran until March of this year. And then President Biden in March has now extended this all the way through the end of September. The employer mandate was not extended. So what that means is, as a business, you are not forced to provide this to your employees. It is optional. You can choose not to offer it. I put on there, why not? The government is giving you the money to pay for this, so there is no financial cost. There could be maybe some operational concerns about employees being out, but if they're sick or legitimately sick, then you probably don't want them in the workplace anyways. On April 1st, the time that is available to employees has reset. So they get 2 weeks again. So they had 2 weeks of sick or family leave that they could have used from April 1st of 2020 through March 31st of this year. And now they have a new 2-week balance that they can use between now and September 30th. The leave reasons, we still have the 6 original reasons, which I won't cover those, but those are the same reasons. But now the new reasons are immunization and time off for recovery. Excuse me. So if someone, and I've heard a lot of reports of the second shot knocking out people for a day or sometimes 2 days. So the employee can take that time off and be paid for it. You would pay them under the FFCRA sick leave, and through that be eligible for a tax credit for 100% of their wages plus the employer share of taxes. I put down there proof. With all other FFCRA leave, Congress wanted to make this as easy as possible for employees to take this time off and not have to worry about getting doctor's notes to provide to you. So, so Congress said that no documentation is required. But you should still get something in writing from the employee that they are requesting this time off for that reason. I'll have my email address up at the end of the slide. We've created a template document that you can use. So if somebody wants this time off and you don't have any sort of formal request, they should complete this. That way you just have something in your records should there be an IRS audit down the line. The time off that resets on 4/1 appears to be just the 2 weeks leave. There was an additional 10 weeks of leave of EFMLA, and it's not clear in the act that resets. We're waiting on the Department of Labor to come up with a clarification. I was just on their website a short while before the presentation, and Department of Labor has not updated the FFCRA since December 31st. So I'm not sure how quick they're going to get to clarification on that, but definitely they have 2 weeks, which is certainly enough if somebody blown through their time last year and now they want time off for a shot or recovery. There's a question about you work for a municipality and getting the tax credit. This the tax credit for this is filed on the 941 tax return. So it is on your quarterly tax return. There's the return was redesigned last year. So there's a specific line for FFCRA sick leave or FFCRA family leave. Right. There are a couple of grants that have come about. And if you're in these industries, you may have heard about it. I know a lot of businesses that I've spoken with or have not. So I'm just going to touch on these two. If you are a restaurant or bar or in that industry, so a food truck or a caterer, if you touch food or beverage, there is $26.8 billion put into a grant. The process has not opened yet, and it will be directly with the SBA. So similar to the way you would file for the EIDL loan. You'll go to SBA, and if you go there now, it talks about it, but it's not open yet. How much is available is your 2019 revenue minus your 2020 revenue minus your PPP loans. So if you had some significant drops in revenue, the government is willing to just give you that money. There is one condition. They say you just have to spend it in your business. You know, you can't go out and buy a boat with it, or you can't just close up your business the day after you get it. You are required just to spend it back in your business. There's not much requirement other than that. It can be on payroll, on rent, on food supplies, on beverage, just pretty much anything to operate your business. So for the restaurants and bars that have hung in there, this is going to recover them as if 2020 was not a bad year. The other industry that is getting a very similar grant is the shuttered businesses, and that's what they call the live venues. So performing arts, live performing arts, movie theaters, museums, these venues that just could not operate in pretty much any capacity. You do have to meet a qualification of a 25% reduction in revenue in 2020, which is probably not a problem for any business in this industry. Again, this is going to be applied for at SBA. The process just opened, I want to say yesterday. Yeah, so this just opened yesterday, but I've heard some news reports that it failed. The website crashed and people weren't able to finish. So so if this is one of your industries, you want to go back to SBA and monitor that for when it gets back online. What they are giving for this grant is 45% of your revenue for 2019, up to $10 million. And again, similar to the restaurant and bar, there does not appear to be any sort of restrictions other than you just need to spend that money back in your operation. Payroll, rent, utilities, insurance, just whatever it is to keep that business surviving until we see the other end of this pandemic. Jumping into another tax credit that came about in the act last month. And we saw this same act back in 2009 when we were recovering out of the 2008 crash. Temporarily terminated or separated, so they're fired. So it doesn't include if they quit or retired. So if they are involuntarily separated and they are eligible for COBRA, which means they had health insurance at the time of separation, they will not have to pay for their health insurance on COBRA between now and September 30th. There is a notice that you will need to provide your employees, the separated employees. Department of Labor is supposed to come out with a model notification actually tomorrow. They indicated on the 10th. So I'm curious if this actually comes out over the weekend or if we'll see it on Monday. So for any involuntarily separated employee, you are mandated to provide the employee with this notice that will alert them that they do not have to pay for their health insurance if they continue on COBRA. And the way that works is you as the employer will still have your bill for the health insurance, and the amount of the premium for that employee plus a 2% administrative fee you will be able to take as a payroll tax credit on your 941. So we're expected to see yet another revision of the 941 form come out sometime in the next 3 months before we get to the end of this quarter. All right. And I'm going to spend, I think, the rest of the time on this piece, the employee retention credit or employee retention tax credit. It is the biggest secret of money available to your business. this has been around since the CARES Act last March. It went into effect on March 13th. And back then when it came out, the government and Congress all thought that COVID-19 was a short-lived event. If you recall, we had the 15 days to stop the spread, and then 30 days to stop the spread. So this came out during those early days when they thought we would be over this in a couple of months. So the government said you could either do PPP or the retention credit. They're both great benefits, but you pick one. And my theory is whenever you say, a tax credit or you have to involve the IRS, it kind of gets frowned upon, and PPP won the spotlight because everybody knew how to go to the bank and ask for money. And if you don't have to pay it back, well, that seems like the popular thing everybody was jumping on, and the news jumped on it. So all the press went PPP, and this just was blown over. And because you couldn't do both, PPP was in the news. In December, President Trump signed the CA Act, which came in and opened the PPP process again. But what it also did was it allowed businesses to also do the retention credit along with the PPP. If you do one, it doesn't prevent you from doing the other. They can't overlap, which we'll talk about that in a moment. But again, because the PPP opened up, the news jumped all over PPP, and everybody ran out the door to the banks and re-upped a second draw. But this is here. There are a couple of qualifications which we'll talk about, and if you meet that, this is a huge benefit. Your business must have been fully or partially suspended by a government order, and we'll talk about that in a minute, or the business's revenue must have decreased in a calendar quarter. It's one or the other. Some companies experience both, but you don't have to experience both. It's one or the other. And if you do qualify, depending on the length of time, you could receive up to $33,000 per employee over the lifespan of this credit. So if you have just 10 employees, this could amount to $330,000. So it's not a small ticket item. All right, so one of the conditions is your suspension. It could be by federal, state, county, city, local, just any government entity that comes in and tells you you cannot operate your business in the same capacity you did pre-COVID. So for example, if you're a restaurant, there was a point in time early on where many businesses were closed, only essential businesses. That is a full closure for those businesses. And then for restaurants in Palm Beach County, for example, you were able to open partially, 25% indoors, and you can do all the takeout and delivery you want. Then we moved to 50% capacity. Again, that's still partial suspension. And then it ran until, I think, September 26th of 2020 when the business was able to fully open. So for restaurants, you were partially suspended between like March 18th and February 25th, I think it was. There are a couple of conditions to this. So if you have maybe a travel agency and you have an office and you couldn't open the office, but everyone can work from home. Well, that is not a condition where you would be eligible to qualify under this. The suspension also works on your suppliers. So if you sell a product and the factory that makes that product was suspended, and you cannot get that product to sell, even though you may not be fully or partially suspended, but because your supplier is, that would qualify you. So it's there's some loose translations in here, and the IRS gives a lot of examples as to what meets a partial suspension. The other qualification is your revenue dropped, and here's the IRS's definition. It's your total sales from operations. I think I saw a question that there may be a nonprofit out there, so nonprofits, you also qualify for this. And the second definition talks about more of the nonprofits, so that includes grants and gifts and contributions. That's all totaled up into your gross receipts. The rules are quite complicated, so I'm going to break it down on 2 slides, and they do differ between 2020 and 2021. For 2020, this still falls under, in essence, the CARES Act that was passed in last March. You must have had at least 100 or less full-time employees. This is not FTE, it's not full-time equivalent, it's the employee works full-time, they count. The employee works 35 hours a week every week, that is not full-time, they don't count. So I ran this calculation on a hotel that had 145 employees or so, and they qualified because 46 of their employees over the course of 2019 did not work full-time the entire year. So so you may meet this even though you have over 100. Of course, your business must have been fully or partially suspended, or the gross receipts test is pretty steep. Your sales must have dropped 50% in any quarter. And then once they drop 50%, they have to remain at least a 20% drop in order to maintain that credit for subsequent quarters. So again, I've spoken to some businesses, some restaurants where their sales really didn't drop by much because they're able to deliver and do carry out, but they still fall under suspended, so they qualify for this. And how much you get is 50% of the wages you pay your employees, up to $5,000 per person. So if you have 10 people and everyone earned at least $10,000 during one of these 2 conditions, you're going to get $5,000 per employee. For 2021, for this year, again, this is extended all the way through December of this year. They made it a little bit more generous on the size of the company, so you can have up to 500 full-time employees. So if you are in that 150 and maybe you just missed it for 2020, you qualify for this year. The suspended still exists, or your gross receipts only have to be down by at least 20% in any calendar quarter. And the comparison for this year is to pre-COVID, so it's compared to the same quarter in 2019. The amount that you will get is 70% of your employees' wages, up to $7,000 per person per quarter. So every quarter you qualify, the government is going to give you 70% of the wages you pay to that employee. So this is a huge credit. And going back to the PPP, they can't overlap the wages. So kind of what that means is if you, let's say for first quarter this year, your sales were down 25%, all right, you qualify, and you got a second PPP on February 1st. So what this means is that we can use the month of January. The month of January is not PPP wages, it's ERC eligible wages. So you can take the credit for January, then your PPP money lasts February, March, maybe April, and so forth. So the two can run side by side, they just can't overlap. There's a few exclusions on what counts as wages eligible for the ERC. So by the name of it, it is employee retention credit. So severance wages are not retaining your employee, you separated your employee, so those don't count. You know, again, wages you paid with PPP. You paid the wages, but that was, you paid it not with your money, so that doesn't count. And the same for these other items. These are basically wages you're paying with someone else's money. So the government is saying, look, you just can't use the same wages twice. There's also an exclusion for wages you pay to family members. So any family members on payroll, unfortunately, they don't count. The government is just trying to prevent companies from hiring, you know, their whole family and children and grandparents and saying, oh, all of a sudden I have a big payroll, and you're just using that to get money out of this ERC. So if you are a client of ours, or if you're not, we're happy to answer any questions on this and look at it and see what could possibly be eligible. Right, so I think that is my 30 minutes there. You know, one last piece, if you go to blog.paymaster.com, twice a month, I am writing a news article of whatever a hot topic is. So if you go there, you'll find articles on the ERC, the family medical leave, and everything else that has come about.